Hello, I'm Dr. Pavlina Suchanova, and I would like to talk to you about septoplasty today. Many millions of people in America can't breathe because of a deviated septum. I'm sure you've heard this term before. What is a deviated septum? Deviated septum is a bone and cartilage. It's basically a wall in the middle of the nose. In the perfect world, the wall would be very nice and straight, and your breathing will be great. But a lot of patients that I see have very badly deviated septum. What it means is that the wall deviates from the midline, and sometimes not just once, but many times. What would be the causes of this deviation? The truth is many patients don't know. This can be from birth, this can be from childhood injury, this can be from sports injury, or both. What's important is whether you have it or not and what I can do about it. If you think you might have a deviated septum, if you have trouble breathing from your nose, it's very easy to find out. I recommend you make an appointment with me in office, and we will perform a very small procedure in the office that takes about 2-3 minutes, which is called nasal endoscopy. It's a painless procedure I do with a very little flexible camera. And while we are looking in the monitor, both you and me, we'll be able to evaluate your septum. Sometimes deviated septum is very apparent even right here in the front of the nose. Some patients with very severe deviations have this portion of the nose, and they lift up very crooked. But not all. You can have very straight nose, and that's the misconception. Your nose can look beautiful and perfect on the outside, and yet you can have very deviated septum on the inside. The way to know is to perform very small procedure, nasal endoscopy. Once we perform the procedure together and we find whether you have a deviated septum, the next step that I will usually do is to order a picture of the nose, which is called a CT scan of the nose. Why do I do that? If somebody has a very severely deviated septum, the CT scan of the nose really gives me a map to see how badly and in which areas the septum is broken, and also will give me a glimpse to a lot of other structures that may be also abnormal because of the deviation. One of the most common things that I see in conjunction with the deviated septum is something that's called concha bullosa. Concha bullosa is a big medical term, but basically means turbinate that's right next to the septum that cracked also at the same time as the septum. And then now it's basically like a big pear, kind of right here, giving you worsening nasal obstruction. Also can cause significant sinus pressure or pain kind of right in that area. Sometimes the CT scan also will reveal other problems such as chronic sinus blockages or polyps as well. Once we perform the CT scan of the nose as well and find out if there are any other structures involved, you will come for one more visit with me in which I will show you the results of the scan. I think this is a really important part of the step. I really like for my patients to be involved in their care, in their decision on what to do next. Because in today's world, there's a lot of options depending on your preferences and depending on what your CT scan shows. Once we review the CT scans together, if I identify that you have severely or moderately severely deviated septum, I will usually recommend to proceed with what's called septoplasty. Septoplasty is a procedure that is invasive because it's fixing a broken bone and cartilage, but it's a procedure that's usually done in an outpatient surgery center, and it takes about 45 minutes to an hour. The patients always ask me, I've seen my neighbor, they had septum fixed 20 years ago. It was horrible. I have a discussion with my patients. Even though the septoplasty itself can cause some pain post-operatively, with today's technique and the techniques I use, the post-op pain and the bleeding are usually kept to a minimum. What my patients experience in terms of post-op procedure pain is usually 3 days of Tylenol or ibuprofen. Few patients take stronger pain medication, which I'll provide, and the techniques I use, the post-op pain and the bleeding are usually kept to a minimum. What to expect on the day of the procedure? Again, you will arrive at the outpatient surgery center. Usually, I do my procedures in the morning. It's important that you do not eat or drink after midnight to keep the surgery safe. On the day of the procedure, you will arrive at the surgery center. You will meet a great anesthesiologist, and we will induce general anesthesia and put you to sleep in a very safe environment for about 1 hour. I perform endoscopic septoplasty. Endoscopic septoplasty means I'm able to fix the crooked bone completely with using endoscope, a camera that's inserted to the nose. And I'm doing the whole surgery on the monitor while I'm looking at the monitor. I think endoscopic septoplasties let me fix patients that have very severely deviated septum that are not fixed with the traditional techniques. And I think it also lets me fix the septums much better because I can see much easier and perform what's called complete septoplasty with fixing the septum all the way from the front to the end. I think this is important because it gives patients better results. The traditional way of doing the septoplasty would be with placing a headlight on the forehead and using metal, basically prongs, to spread the nostrils and look through the headlight in the nose. This, of course, causes much more difficulty in seeing the entire septum and fixing the entire bone correctly. After about 1 hour, usually able to fix even the most severe deviated septum. What to expect after the procedure? We will watch you in the recovery room for about an hour and a half, and if you are doing well, we will send you home with your family or friends. What to expect the first week following recovery from the septoplasty? My patients will have what's called a dog splints, very small plastic tubes that are hollow on the inside, in the nose for the first week after surgery. This ensures that the septum heals correctly. It's very straight. And I think it really helps so that we can flush during the post-op phase with the saline. I think the flushing, patients always tell me, Dr. Suchanova, I'm really excited whenever I can flush. We flush 3 times a day after the surgery because it makes me feel so much better and it keeps everything really nice and clean. But when we don't use the plastic tubes, the nose tends to swell shut for the first 3-4 days, and I think that's extremely uncomfortable for patients. After the first week of flushing and irrigating the nose 2 to 3 times a day, you will have what's called the first post-op visit. I know patients are always very apprehensive about what's going to happen during the post-op visit, but I tell my patients this will be, for you and for me, one of the happiest visits we'll ever have. And the reason is, during the post-op visit, I will remove gently the plastic tubes. There's one stitch that's holding the tubes together. Once I cut the stitch, the tubes just slide out and I'll suction the nose from all the mucus. And then the great finale comes when I ask my patients to breathe. About 50% of the patients, when they first take a deep breath, they cry with happiness. This is why it's so rewarding to fix a patient who has severely deviated septum, because I think the results for patients are life-changing. It's one of my favorite procedures that I do in OR because, again, patients are not only happy, but they're just so grateful and they're so emotional because breathing does something to you that you can't describe. And I see this every day when I remove the stents out. I see it on my patients. I had a patient the other day tell me something that I will never forget. And she said she's breathing so much better that she's smelling colors. It's a procedure that does require you to recover. It does require for you to take a few days of pain and medication. But I think it's a procedure that's extremely rewarding for both the patient and me as the physician. So if you suffer from nasal obstruction and if you think you might have a deviated septum, please make an appointment.